What if I told you that for like 85% of women suffering from severe unexplained breast pain, the cure isn't actually in a pharmacy aisle. It's in a lingerie drawer.
I mean, I know it sounds completely absurd, but when you look at the clinical data, it is genuinely one of the most effective immediate treatments available. And yet, it's almost never the first thing people try.
Exactly.
Yeah.
Because when you're dealing with menopausal breast pain, your first instinct is obviously to look for a medical fix.
Right, yeah. You want a pill.
Yeah, you walk into any pharmacy or a health food store, and you find yourself staring at the supplement aisle.
Ugh.
And right there, usually front and center in these little amber glass bottles, are those glowing golden capsules of Evening Primrose Oil.
Oh, yeah. They look so perfectly natural.
They really do.
Yeah.
And the label promises relief for something that affects a massive portion of the population, yet is so rarely talked about openly.
Yeah.
Medically, it's known as nostalgia.
And it is a deeply isolating pain. I mean, for many women, their doctors are just so quick to dismiss it as, just another symptom of aging.
Right. You're supposed to getting older.
Exactly. Which leaves them to essentially figure it out themselves in that exact supplement aisle.
Which is exactly why we are doing this deep dive for you today. Because if you take that same bottle of golden evening primrose oil into a doctor's office, you are going to get two wildly different reactions, just depending on who you ask.
Yeah, it's a very polarized topic.
You have naturopathic doctors and certain pilot studies praising these oils as this targeted cellular therapy. But then you have major health organizations like the UK's National Institute for Health and Care Excellence explicitly stating there is little to no evidence that it actually works.
It is a profound split in the medical world, and, it leaves the patient caught right in the middle, spending money and just hoping for a miracle.
So today, our mission is to cut through all that confusion. Can evening primrose oil, or its cousin starflower oil, actually treat menopausal breast tenderness? We're going to decode the science of what these fatty acids actually do to your cells, separate the marketing hype from the hard medical data, and give you practical, evidence-based takeaways that you can actually use.
But before we can evaluate the cure, we really have to understand the cause. I mean, why do breasts suddenly start hurting so much during the menopausal transition in the first place?
Right.
Because if we don't understand the environment, we won't understand how the oil is even supposed to fix it.
Okay, let's unpack this.
Yeah.
Because to understand that, we have to break this pain down into two distinct categories. You got cyclical pain and non-cyclical pain.
Mm-hmm.
Cyclical nostalgia is the kind that's linked directly to the menstrual cycle. It gets noticeably worse just before a period and then eases up once the period starts. And this is incredibly common in the 30 to 50 age bracket, right in the thick of perimenopause.
And then you have non-cyclical pain, which doesn't follow that predictable monthly rhythm at all.
It's just random.
Yeah, it can be a continuous ache or it might be intermittent. And it's actually more common a bit later on in women in their late 40s and 50s moving into actual post-menopause.
Well, the perimenopause phase isn't just a gentle decline into a new normal. It's where things get genuinely turbulent.
Oh, absolutely.
During perimenopause, your hormones, specifically estrogen and progesterone, they don't just slowly fade away, they spike and crash completely unpredictably. So think of your breast tissue like a highly absorbent sponge sitting inside a fixed, rigid container.
That is actually a highly accurate way to visualize the mechanics of it.
Right, so when the water, which in this case represents those spiking hormones, suddenly surges through your system, that sponge absorbs it rapidly.
Yeah, the milk ducts and the glands inside the breast just swell right up.
Exactly. They trap fluid, and because they're inside a fixed space, they press outward against the surrounding tissue and nerve endings. That unpredictable swelling and pressure is what causes the pain. You're basically walking around with a hyperinflated sponge in your chest.
And that tissue is incredibly sensitive to even minor shifts in that hormonal water level. But there is also a secondary physical change happening inside the breast at this exact same time. It's a natural physiological process called lobular involution.
Lobular involution. I mean, it sounds like something from an advanced physics textbook. But it's happening in millions of women right now. What does that actually feel like on a physical level?
Well, as women age, the glandular tissue in the breast, the dense tissue that is originally responsible for making milk, it begins to break down, and it's gradually replaced by much softer fat tissue.
Oh, wow.
Yeah, and this isn't a sudden event. It starts happening subtly around age 30 and affects almost 75% of women in their 40s. But as those internal structures shift and remodel themselves, the breast tissue is essentially under physical construction.
So it's literally rebuilding itself.
Yes, and that remodeling process itself can cause a deep, continuous ache or tenderness.
And we also have to factor in hormone replacement therapy, or HRT, because while HRT is fantastic and often life-changing for managing severe menopausal symptoms like hot flushes and night sweats, it is essentially pouring that hormonal water right back into the sponge.
Precisely. HRT re-stimulates the breast tissue that was beginning to quiet down. It wakes the glands back up, which is why breast tenderness is routinely listed as one of the most common immediate side effects of starting HRT.
If we connect this to the bigger picture, it's crucial to pause here and offer a moment of, well, profound reassurance to you listening. Because let's be honest, when unexpected severe pain hits the breast area, the immediate terrifying thought for almost everyone is cancer.
Absolutely. The anxiety is often way worse than the pain itself. But the medical guidelines are incredibly clear across the board on this point. Breast pain, especially this kind of diffuse, heavy hormonal aching that affects the whole area, is almost never an early sign of breast cancer.
That is so important to hear.
It really is. Breast cancer typically presents as a painless lump or a skin change. What we're talking about today is a perfectly normal, albeit highly uncomfortable, physiological response to an internal chemical storm.
It is a chemical storm. And because it's driven by chemicals, it makes total sense that patients have historically looked for a chemical anchor to stabilize it. Which brings us right back to the supplement aisle. Enter our proposed heroes, Evening Primrose Oil and Starflower Oil, which you'll also see sold under the name borage oil.
Yes, borage oil.
Why have these two specific oils become the go-to recommendation everywhere from supermarket shelves to naturopathic clinics?
Well, it all comes down to a secret weapon hiding inside both of these oils. They contain a very specific, highly active type of omega-6 fatty acid called gamma-linolenic acid, or GLA for short.
Okay, let's get into the biochemistry of GLA, because this is where the naturopathic philosophy and the hardcore cellular biology actually seem to align. What is GLA doing when it enters the body?
To understand GLA, you have to look at what the body builds with it. Research has shown that some women who experience this severe cyclical breast pain actually have unusually low levels of GLA naturally present in their tissues.
Oh, really?
Yeah. And your body uses GLA as a fundamental building block to form what we call good prostaglandins. The most important one here is called PGE1.
Wait, prostaglandins, those are the compounds that act like local messengers to deal with inflammation, right?
Exactly. Think of PGE1 as your body's internal fire extinguisher. It actively calms inflammation, it improves local blood flow, and it inhibits platelets from clumping together. It basically creates a calm, stable cellular environment.
Okay, I'm following.
But if your body is deficient in GLA, it simply doesn't have the raw materials to manufacture those calming fire extinguishers.
So if it can't build the fire extinguishers, what happens when the hormone spikes hit?
The body defaults to producing a predominance of inflammatory molecules instead. These are called leukotrienes, and they act like fire starters.
Ouch.
Yeah, they actively worsen fibrocystic breast changes, and they dramatically increase the tissue's sensitivity to those spiking hormones we talked about earlier. So when the water hits the sponge, the inflammatory leukotrienes make sure every single nerve ending feels it acutely.
That makes total biological sense. The theory is, if you supplement with a heavy dose of GLA, you flood the body with the raw materials it needs to switch production from fire starters back to fire extinguishers.
That's the idea, exactly.
But when it comes to actually delivering that GLA, there is a massive logistical difference between Evening Primrose Oil and Starflower Oil, isn't there?
A huge difference. And it comes down to sheer efficiency and concentration. Evening Primrose Oil is famous. It has incredible brand recognition. But chemically, it only contains about 9% GLA.
Only 9%.
Yeah. Now, the therapeutic dose required to actually change your cellular chemistry and flip that inflammation switch is between 240 and 360 milligrams of pure GLA a day.
Which means if you're relying on a 9% concentration, you have to take an enormous amount of oil.
You do. To hit that target with standard Evening Primrose Oil, a patient might have to swallow up to 6 large 500 milligram capsules every single day.
6 giant oil pills a day. That is a massive daily commitment. I mean, I can't imagine trying to keep up with that regimen month after month.
It leads to a lot of treatment fatigue. Starflower oil, or borage oil, on the other hand, is a much more concentrated botanical source. It contains almost double the amount of GLA, sometimes hovering around 20% or even slightly more.
Okay, so that's a lot better.
It is. That means you can take far fewer capsules, maybe just 1 or 2 a day, to achieve the exact same biological effect.
Now, I have to stop and think about how this actually treats the pain, because this is a really counterintuitive concept. If I have a terrible headache or I pull a muscle at the gym, I take a standard NSAID, like an ibuprofen, and the pain is reliably gone in 20 or 30 minutes.
Right.
But the clinical data is very emphatic that evening primrose oil and starflower oil are not painkillers. How does a fatty acid stop you from feeling pain if it has zero analgesic properties?
That is the critical distinction you have to understand before you spend money on these supplements. And ibuprofen works by temporarily blocking the pain signals from ever reaching your brain. It is masking the pain. GLA does not mask anything. It doesn't block a single pain receptor.
So you still feel whatever's happening in the tissue.
Yes, but what GLA does is gradually change the actual physical environment of your breast tissue.
Oh.
Over a long period of time, it restores that cellular fatty acid balance, effectively rebuilding the cells so they are fundamentally less sensitive to the circulating hormones.
Oh, I see. You're changing the physical makeup of the sponge.
Exactly. You are reinforcing it so that when the hormonal water hits, it simply doesn't swell as aggressively or trigger as much inflammation.
Okay. Let me guess, though. Because you are essentially asking your body to structurally rebuild billions of cell walls and change its entire inflammatory profile, this is not something that happens by Tuesday.
Not even close. It requires immense patience. The medical guidelines state that you have to take these oils daily without interruption for a minimum of 2 to 6 months before you will see any noticeable benefit whatsoever.
Wow. 2 to 6 months.
Yeah, it is a slow, methodical, structural shift at the microscopic level.
Here's where it gets really interesting for me. The biological mechanism of GLA makes so much logical sense. It replaces a missing fatty acid, it builds anti-inflammatory prostaglandins, it desensitizes the tissue. It sounds like a perfect, elegant solution.
On paper, yes.
So why isn't it universally prescribed by every single doctor? Why is there such a massive divide in the medical community?
And that brings us to the great efficacy debate. It is one of the most fascinating controversies in women's health, because when you evaluate the medical literature, it is a landscape of stark, almost irreconcilable contradictions.
Let's look at the enthusiastic side first. Naturopathic clinics report truly excellent long-term results. They see total reversals of severe fibrocystic breast changes after a year of consistent high-dose GLA therapy.
They do.
And it's not just naturopaths. There are legitimate pilot studies, like a notable one from the Mayo Clinic, that looked at a combination of evening primrose oil paired with vitamin E. They found a strong trend toward a significant reduction in the severity of cyclical mastalgia. In fact, many early studies confidently suggested that up to 50% of patients responded positively to the therapy.
Which is huge. I mean, 50% is a massive number in pain management.
Yeah.
But then you flip the coin, you look at the official modern guidelines from the UK's National Institute for Health and Care Excellence, NICE, which is a global standard bearer for evidence-based medicine. You also look at several regional NHS trusts. They explicitly state there is little to no evidence that evening primrose oil helps.
Little to no evidence.
Yeah, and they have entirely stopped routinely recommending it.
That is a brutal assessment.
It is. They point out that those early optimistic studies showing a 50% success rate have consistently struggled to be replicated in later, more rigorous, double-blind, placebo-controlled clinical trials.
So if the major medical bodies say the evidence is practically non-existent, but half the patients in early studies, plus countless women anecdotally online and in clinics, swear that it absolutely gave them their lives back, what is actually going on here? Is Western medicine just fundamentally bad at measuring the nuanced, slow-acting effects of natural supplements? Or are we just looking at a really, really effective placebo?
What's fascinating here is the unpredictable nature of the pain itself. Mastalgia, particularly the cyclical kind tied to perimenopause, is highly subjective. It naturally fluctuates from month to month based on stress, diet, and minor hormonal shifts. But crucially, it often resolves entirely on its own over time as the body settles into postmenopause.
It burns itself out. The storm eventually passes.
Exactly. So imagine you are designing a clinical trial. A woman enrolls, and she diligently takes evening primrose oil every single day for 6 months. At the end of those 6 months, her pain is significantly reduced or completely gone. She's thrilled.
Understandably.
But because the pain naturally waxes and wanes and often burns out on a timeline of several months anyway, it is incredibly difficult for clinical researchers to definitively prove causation.
Mhm.
Did the GLA from the oil cure the pain, or did the hormonal storm simply pass and the pain burned itself out naturally while she just happened to be swallowing golden capsules every morning?
That makes perfect sense. It's the ultimate confounding variable. The timeline for the cure perfectly overlaps with the timeline for natural resolution.
Exactly.
But because the oil is viewed as a safe, natural substance with a botanical drawing on the bottle, patient acceptance is incredibly high. Even doctors who doubt the data often say, well, it probably won't hurt, so it's worth a try if you're desperate. But that leads us into the fine print, because taking heavy daily doses of these fatty acids is not as simple as popping a daily multivitamin. There are actual serious dangers.
Yes, and this is crucial information that often gets lost in the marketing. Just because a substance is extracted from a plant does not mean it is biologically harmless for everyone.
Right.
Both Evening Primrose Oil and Starflower Oil carry strict contraindications, particularly for people with neurological conditions like epilepsy or schizophrenia.
Let me use some deductive reasoning here. If GLA fundamentally alters cellular signaling and reduces nerve inflammation, it must be crossing the blood-brain barrier. Does it mess with the delicate electrical and neurological balance in someone with epilepsy?
You hit the nail on the head. The specific active compounds in these oils can actually lower the seizure threshold. For a healthy brain, that's unnoticeable. But for someone vulnerable to seizures, lowering that threshold makes an active seizure significantly more likely. It is a profound neurological interaction from a seemingly harmless supplement.
And there are serious cardiovascular warnings too, right?
Absolutely. Remember how we said PGE1, the good prostaglandin, inhibits platelets from clumping together?
Right, stops the fire starters.
Well, platelet clumping is exactly how your blood clots when you are injured. By inhibiting that, these oils naturally increase your risk of bruising and bleeding. That means if you are on prescribed blood thinners like warfarin, taking high doses of Evening Primrose Oil is dangerous because it amplifies the blood thinning effect.
Wow, okay.
Furthermore, you absolutely must stop taking these supplements at least 2 weeks before any scheduled surgery to prevent excessive, uncontrollable bleeding on the operating table.
That is a massive caveat that you do not see printed in bold warning letters on the front of the bottle in the supermarket. And honestly, considering the massive daily pill burden, the 6-month waiting period, the questionable clinical efficacy, and these bleeding risks, it really brings us to the alternatives. Because if you were listening to this and thinking, I don't want to spend hundreds of dollars and swallow 6 giant pills a day for a maybe, the sources highlight some shockingly simple alternatives.
They do, and they all follow a core medical philosophy known as conservative management first. The idea is simple. Before you try to systemically alter your body's entire fatty acid profile and blood chemistry, try fixing the basic mechanics of the problem.
And the most effective mechanical fix is a bra. We mentioned this at the very beginning of the deep dive, and I have to emphasize this statistic again because it is staggering. Up to 85% of women find significant relief from breast pain simply by wearing a properly fitted, highly supportive sports bra. 85%.
It is the single most successful intervention available, and it requires Garo pills.
But the reason it's so necessary is that an estimated 70% of women are walking around right now wearing the wrong bra size. We just accept it. We buy the same size we wore 10 years ago, not realizing our breast tissue has completely changed due to that lobular involution we talked about.
If we think back to your sponge analogy, imagine that sponge is getting heavier and more swollen with hormonal fluid. The breasts aren't just floating. They are physically anchored to the chest wall by thin bands of connective tissue called Cooper's ligaments.
Right?
When the heavy fluid-filled tissue bounces or sags, it violently pulls and stretches those ligaments, causing acute mechanical pain on top of the chemical swelling.
So you have chemical fire inside and mechanical tearing outside.
Exactly. A highly supportive, professionally fitted bra, which is sometimes recommended to be worn day and night during the absolute worst of the cyclical pain, acts like an external scaffold. It entirely stops that mechanical stretching. It is a localized, immediate physical fix that works for more than 8 out of 10 people.
It is deeply ironic, isn't it? A patient might spend 6 months and a small fortune dutifully swallowing botanical oils, waiting for their prostaglandins to balance out, when a 30-minute trip to a department store for a professional bra fitting might instantly solve the problem that same afternoon.
It highlights how we often overlook the mechanical in favor of the chemical, But if a bra isn't quite enough to handle the inflammation, what are the other conservative options before moving to systemic pills?
Well, the clinical guidelines heavily lean toward localized anti-inflammatory gels. You can take a standard NSAI gel like diclofenac or ibuprofen and rub it directly into the painful areas of the breast tissue.
The beauty of this approach is precision. You deliver the anti-inflammatory action right where the fire is without forcing your liver and your whole body to process heavy doses of oral painkillers or fatty acids.
But if you really don't want to rely on gels or bras, you can actually change the internal environment of the tissue through your diet. The sources highlight some very specific dietary tweaks. First, reducing caffeine. Caffeine contains compounds called methylxanthines. You can think of them as little chemical agitators that basically make that breast tissue sponge even more hyperreactive to the fluid.
Yeah, they just aggravate everything.
Right. By cutting out coffee and tea, you are removing a major irritant.
They also recommend reducing overall dietary fat intake, which can naturally alter the fatty acid balance without high-dose supplements, and introducing ground flaxseed.
Oh, flaxseed.
Yeah, flaxseed is a phytoestrogen that binds to receptors in the breast tissue and has shown some genuinely positive evidence in clinical trials for calming the tissue down.
And of course, simple over-the-counter painkillers like oral ibuprofen or paracetamol are always an option for acute bad days. Now, we should mention that there are heavy-duty prescription drugs available for this, right?
There are drugs like tamoxifen or danazol, which are powerful hormone blockers. But I want to stress that these are strictly, absolutely a last resort for severe refractory pain that is ruining a patient's quality of life.
Because of the side effects.
Yes. The side effects of these drugs, like intense hot flushes, significant weight gain, deepening of the voice, and a highly increased risk of dangerous blood clots, they can be far more brutal than the breast pain itself. They are rarely prescribed for simple nostalgia.
So what does this all mean for you listening right now? Let's bring it all together. Today's mission was to find out if Evening Primrose Oil or Starflower Oil can effectively treat menopausal breast pain. The answer is a definitive maybe, heavily leaning toward probably not.
Yeah, that's fair.
They might help by supplying your cells with GLA to build calming prostaglandins and reduce tissue sensitivity to fluctuating hormones. But they are not painkillers. They require months of expensive daily dedication, they carry hidden neurological and cardiovascular risks, and the major clinical guidelines remain deeply unconvinced by the data, often attributing any perceived success to the placebo effect or the natural fading of the pain over time.
It is a classic case of weighing the immense effort against the flimsy evidence. Always employ conservative management first. Try the mechanical fix with a proper bra fitting. Try the localized fix with an anti-inflammatory gel. Try cutting out the caffeine agitators. Do all of that before you commit your body to the systemic fix of heavy oils.
But as we wrap up, there is one more thing we need to discuss. It's a subtle detail buried deep in the clinical sources, specifically in the Scottish Rite Decision Service pathway for managing symptomatic breast pain. And it completely reframes this entire conversation.
It really does. The Scottish pathway notes that while breast pain is incredibly common, accounting for roughly 15% of all clinical referrals to breast clinics, almost all people who are referred to secondary care with postmenopausal breast pain actually just have chest wall or musculoskeletal pain.
Let that sink in for a second. The pain isn't originating in the breast tissue at all.
Exactly. It feels like breast pain because it is right underneath the breast, but it is actually an inflamed rib joint, a pulled pectoral muscle, or the physical wear and tear of a condition like costochondritis.
The provocative question we want to leave you with is this. How much of the medical anxiety, the desperate searching for complex hormonal cures, the hundreds of dollars spent, and the months of swallowing massive Evening Primrose Oil capsules? Wait, I mean, swallowing all those pills, how much of that is completely misdirected simply because we, and sometimes even our busy doctors, are misidentifying a sore rib muscle or an inflamed chest joint as hormonal breast tissue?
It highlights the profound danger of assumption in medicine. We assume the pain is hormonal because of our age and the perimenopausal transition. We expect hormone trouble.
Yeah.
When in reality, it might just be the physical wear and tear of life showing up in the muscles beneath the breast, requiring nothing more than a good stretch, some physical therapy, or a warm compress.
It goes right back to what we said at the start.
Yeah.
You walk down that supplement aisle and you see that amber bottle of magic promising to fix your raging hormones. But before you buy it, maybe just check if what you really need is a better bra, a little localized ibuprofen gel, or just a good deep stretch for your chest wall. Thank you for joining us on this deep dive. Keep asking questions, keep challenging the promises printed on the bottles, and stay curious.